Hi, welcome back to Mental Health with Bay in our Dialectical Behavior series. I'm Bay, and in this video we're going to talk about what DBT is, what DBT stands for and why, what the program might look like if you go into a DBT program, and the effectiveness of DBT for different conditions. DBT stands for Dialectical Behavior Therapy. Behavior therapy because it is a therapy that focuses on behaviors rather than cognition, actions rather than motivations or thoughts. There are different behavior therapies. There's ABA, which is applied behavior analysis, CBT, which is cognitive behavior therapy, the cognition with the actions. DBT is dialectical behavior therapy. Marsha Linehan, the creator of DBT, who I talk about in my last video, named it dialectical behavior therapy because she was noticing a dialectic. Dialectic is when two opposing ideas can be true at the same time. Marsha was working with the first patients that comprised the first study done on DBT. She would tell them, hey, you need to step it up, you can be doing better, you need to be doing better. The patients would shut down, they'd withdraw from the study, they'd stop coming to therapy. If she was very validating, oh, you're doing the best you can do, there's nothing wrong with you, you have no problems, then people would not change and not get better. So she decided on a dialectic approach. People are doing the best they can, and they can and should be doing better. Putting those two ideas together in front of the clients and saying that they are true at the same time was what got people to both stay in therapy and change and make positive behavior changes in their lives that ultimately led to a lot of healing. Dialectical behavior therapy. DBT skills are separated into four main categories. There are mindfulness skills, distress tolerance skills, emotion regulation skills, and interpersonal effectiveness skills. I like to think of mindfulness as kind of the umbrella that encompasses the rest of the skills, and that the other three are kind of their own distinct categories within mindfulness. A DBT program is structured to have four main components. There is a weekly skills group, a group of people and one or two therapists will go over the skills for that week, and there's weekly homework, there's accountability, there's validation, there's camaraderie. Group is great. There is a weekly individual session with your therapist, 45 minutes to an hour. Phone coaching, so being able to text or call your therapist is part of a DBT program. The program I did, you could text or call your therapist during their green hours and they would get back to you within 20 minutes. They had orange hours where they'd maybe get back to you within an hour or two, and then they had red hours where they were not expected to get back to you. And then the fourth category of a DBT program is that the professionals meet all together once a week to talk about their clients, discuss different issues they might be facing, things that they might have on their mind, to prevent burnout and also get a lot of different takes on a lot of different really complex situations with complex clients. DBT was shown to be effective for a number of disorders. It was first studied to decrease suicidal behavior in patients with borderline personality disorder. It has since been shown to be effective for cluster B personality disorders, self-harming individuals with personality disorders, ADHD, PTSD, major depression, including treatment-resistant depression, bipolar disorder, transdiagnostic emotion dysregulation, suicidal and self-harming adolescents, pre-adolescent children with severe emotional and behavioral dysregulation, binge eating disorder, and bulimia. The very first study done on DBT was in 1991 with a group of women with borderline personality disorder, and since many studies have been done to continue to prove its effectiveness in different populations, different genders, different backgrounds, ages, etc. None of the evidence is showing that it doesn't work for pretty much anybody. Pretty much whoever you are, DBT will be helpful for you. I also want to point out that DBT therapy is not a trauma therapy. It is a behavior therapy that does not target trauma. The reason that someone with trauma would do DBT will help these people build skills to keep themselves safe and regulated long enough that they could do trauma therapy. DBT is more of a pre-trauma treatment. Thank you so much for watching this video about DBT. In my next video, I'm going to be talking about why we use DBT skills and how they can be effective for us. Make sure to like and subscribe for more free mental health content. Bye.